Hello, my name is Ryan Kennedy. I'm an endocrinologist with the Ultimate Medical Group, and I treat a variety of hormonal disorders, dealing with thyroid disease, adrenal disease, pituitary disease, and what we're going to talk about today, which is disorders with the pancreas, which has to do with what most people know as diabetes. So, diabetes mellitus, there's type 1 and type 2, and mostly what we want to focus is on type 2, where they develop a lot of problems with insulin resistance, which can correlate a lot with different things that you take in through the diet, and maybe how we can do some things to prevent issues with that over the long run. In diabetes, I like to say, is really all about insulin. Whether we're trying to give it to you, we're trying to help you make more of it, or we're trying to help it work better. And insulin's job is to get your cells to take up sugar from the bloodstream, right? So when you pump, and sugar, your cells use sugar like a car uses gasoline. So when you pump gas in the car and turn on that engine, it starts to heat up those gas molecules and break them apart. That releases energy, helps the pistons of the car move, helps the car go. Cells do the same thing with sugar. Take it up, break it apart, releases energy, helps it do the things the cells need to do. And so since your cells always need some fuel, your liver is always breaking things down, putting out sugar into the bloodstream, which ultimately helps signal you to make more insulin. Then at some point you eat something, because we all do. And when we start to eat food, that food travels down our esophagus, hits our stomach, and releases a whole bunch of hormones, which job is to tell us to make more insulin. And as that sugar gets absorbed into your bloodstream, that insulin runs out, starts banging on the doors of your cells saying open up, and so that more sugar can come in, and then your blood sugar starts to go down, your insulin falls down. Unfortunately, over time, where we can start to see where those cells start to get resistant to insulin. So when insulin goes and bangs on the doors, those cells say, go away, we don't want nothing to do with you. And it takes more and more insulin to get those cells to take up sugar. And so that's insulin resistance, and that when they get so resistant to the point that your blood sugars stay high over time, that can be diabetes. Some of the things that we see in culture and in our lives nowadays is that there are different foods and different compositions of foods that make a difference in terms of how high our blood sugar is. So when we see more highly refined processed foods that have been broken down a lot, then our body absorbs those really quickly, and those can raise your blood sugar a lot. So I always want people to try to focus on whole foods. And what do I mean by that? I'll throw a whole bunch of cliches at you. Hopefully some of them make sense. So you want to eat food as close to the way God made it as possible. If you can hunt it or pick it, you can probably eat it. You usually find that on the outside of the grocery store instead of the middle. It's in a box or has more than 5 ingredients. It's probably been processed. It's been processed, it's been broken down before it goes in your body. It's broken down before it goes in your body. You absorb it more quickly, raises your blood sugar quickly. As opposed to a whole food, you could hunt it or pick it or find it on the outside of the grocery store. You know, meats, vegetables, fruits, all those things your mom probably told you was good for you. Then you have to do a lot more work to break that down. You absorb it more slowly, raises your blood sugar less quickly. So if we can focus on those things, that will help us a lot in terms of controlling our blood sugar. So high fiber foods, highly unprocessed foods, and beyond that we can start to look at macronutrients, and we have seen a lot of benefits in starting to use lower carbohydrate intakes in foods in terms of controlling blood sugar, and we can start to think about those macronutrient compositions. But they really want to focus on simple, whole, unprocessed foods for the most parts in terms of controlling blood sugars. Obviously eating less over time has had some benefits in terms of caloric reduction, in terms of lowering blood sugars too, and so if you're certainly overeating, reducing the calories in general can make a big difference. So if you have diabetes, so the first thing is definitely want to see your doctor, make sure you're checking your labs, making sure that everything that you're doing from a medical benefit to keep you from having those complications of diabetes is going into effect, and we're using medications that we need to control your blood sugars. But absolutely focus on eating good, healthy, whole foods, exercise, and try to get enough sleep. All those have great benefits in terms of controlling your blood sugars.